It's time now to ask the expert. Here to answer your questions live on air about skincare is dermatologist Dr. James Pehoushek with All Dermatology. Okay, we got lots of questions. So first up, Jamie in Phoenix says, Korean skincare is having a moment on social media. Is it safe to use? If so, is there a way to know you're buying the real thing versus a fake product? I see Korean skincare
Yes, Korean skincare is huge.
Yes.
Tons of products coming out of there. We actually do some drug studies and they're just coming out like crazy. So again, there's a lot of stuff that's coming down the pipeline from from other places.
Yeah.
Got to be careful of what it is. Some of it's great, some of it's not some of it's not FDA approved. So you got to be careful when you buy products.
How do you know though?
Don't be the first one in line.
Okay.
That's kind of my thing. Give it some time and then see what happens before you start spending a lot of money on product line that maybe is gonna burn your skin or leave you with some problems. So again, don't fall victim to the TikToks.
Yeah, maybe go with the tried and true, as you were saying before. This viewer says, my wife has gone through chemo treatments. Is there a specific way or a specific treatment for skincare? Yeah,
and that's a real problem. We have patients that come in with that periodically. Aloe, pure aloe can help.
Okay.
Aquaphor, Vaseline, just simple things. And then your doctor can get you a prescription for Sylvanine cream, which is also very inexpensive. It's prescription, but it can work and it can help a lot.
Yeah.
So,
for that ultra hydrating, that's what you're looking at?
You want to protect the skin. You want to kind of lock in the moisture and give it a chance to heal because radiation is very tough on the skin.
Yeah, I bet. Okay. Jessica in Tempe says, what is the correct order to use products? For example, do I cleanse, tone, moisturize, and then use serums?
Yeah.
Like a multi-step process.
Exactly.
Yeah.
I get that question a lot. And as a guy, I wash my face, put on a little moisturizer. But
think like a woman.
So I sort of think of it, yes, exactly. I sort of look at it as use the stuff that's probably got the biggest bang on the base coat. So if you're using a retinoid, I have that put on first because that's the stuff that you want to get into the skin and penetrate well. So then put on your moisturizer after that. If you have a serum, you know, again, some of it's mix and match, but you got to be careful and you don't want to mix two things together that might inactivate the other one. So that's a problem too.
Okay. I've always heard lightest to heaviest too. Yeah.
Sure.
Okay.
No, I just say, put the most important one on first.
Okay,
like people come in with their acne or their skincare, and I'm like, look, use the one that I really want to do the job first.
Yes, okay, the most potent. All right. Kay from Glendale says, I'm a black woman in my early 60s. I've had hyperpigmentation for 15 years, mostly due to ingrown facial hairs and acne. I haven't been able to stop plucking the hairs daily with tweezers. I've struggled with finding laser options that work for black women. Please help.
Huge problem. I always go to lectures about this. There's a lot in the literature. It's a difficult situation. People with darker skin tones, black people, Hispanics, Asians. Problem is, treat some of these things with a laser or chemical peel, and what you get is a backfire on you. It makes it darker. And I've had that happen in a couple patients that I wasn't expecting it. It's terrible. So the general rule is start very simple. Don't let somebody talk you into something that's a laser because it sounds good, because it might just destroy your skin and make things worse. So go to somebody who's gonna take baby steps at first. Work yourself into stuff, gently work your way in. Like chemical peels, we do test spots. Same with lasers. Do a test spot or something first. But start with topicals first and see how those go. And then if you don't have results with that, your doctor can get you where you need to be.
Oh, good advice.
But
All right.
Tricky.
Yeah, I bet. That's frightening. Okay, this viewer says, how do you remove a cyst from your face? Ooh.
If you're doing it at home, you have a small superficial little cyst, you can get a thing called a comedone extractor.
Okay, yeah.
That sometimes you can buy those in the drugstore. Usually I tell people to get their face warm and moist before you do it, like right after the shower. If it's something that's deeper, go in and see your doctor, because if the thing we see all the time is people who try to pop a cyst and it pops on the inside, then you end up with an abscess, and if it's on your face, you end up with a giant boil on your face, and then you just wish you had your cyst. So be careful.
Okay.
Don't overdo it.
Yeah, just to be safe, go see the dermatologist.
Yeah, go see the dermatologist.
Okay. All right. Thank you so much, James. We appreciate it.